Turn now to neighboring Missouri, and more counties there are mandating wearing masks amid a surge in COVID-19 cases. More than 292,000 people have tested positive there. More than 3,800 people have died. The St. Louis area just broke another hospitalization record this week, forcing officials to send patients to neighboring states with more space. Dr. Alexander Garza is one of those on the front lines of this pandemic. In the battle in Missouri, he's head of St. Louis Metropolitan Pandemic Task Force. Doctor, thank you for being here.
Sure.
How bad is it?
Well, it's the worst that we've seen in the pandemic. Right now, we have over 900 patients in our hospitals, which is a new record for us, and close to 200 in our intensive care units. Yeah. I think what's even more telling is that the nurses are really starting to get worn out from the volume of patients that are coming in and how sick they are.
Yeah, this morning's front page of the St. Louis Dispatch newspaper echoed that, saying that they're just overwrought, they're so exhausted. How concerned are you, though, in the meantime, about a potential uptick from the holiday gatherings that many people had just a few days ago?
Yeah, we're very concerned. We know we're not going to see those patients for a couple of weeks. You know, they'll have to become infected and then get sick enough to come to our hospitals, but we're already at our maximum capacity. And so when we layer on more patients onto that, of course, it's going to exceed our capacity. And as you said, we've been transferring patients outside of the metropolitan area because we're just simply running out of room.
So this was interesting, I thought. There was a St. Louis doctor who simulated what COVID-19 patients see, potentially at least, before dying. That video, of course, went viral within the last couple of weeks. He made an emotional plea for people to wear masks, social distance, or they will experience this. Take a look.
This is what it looks like when you breathe 40 times a minute, have an oxygen level that's dipping well below 80. This is what it's going to look like. I hope that the last moments of your life don't look like this. I promise you, this is what your mother or your father or your children, when they get COVID disease, will see at the end of their life. This is serious.
There's so many ways that people are trying to drive home the impact of this disease and the reality of it. Do you think that one helps?
Right. I think it helps a little bit. Every little bit helps. You know, what we're finding, though, is most people are now sort of entrenched in their views. We're trying to figure out different ways that we can reach people and convey to them the seriousness and the precautions that they need to take to prevent the spread. You know, I think we underestimated the politicalization of mask wearing and other measures that are really putting a hamper on trying to combat the pandemic.
And how accurate is that? Is that, in essence, what, in the waning moments of life when you're COVID, what you're seeing and you're experiencing?
Yeah. Right. So I'm an emergency physician by training, and so I've done a fair amount of putting people on ventilators. And so that's a very accurate depiction on what people see when they come to this sort of fork in the road where they're going to need to be put on a ventilator and be in intensive care. And so it's a very accurate description.
Do you get a sense there in Missouri that you've reached the peak of this?
No. According to our models, the peak is going to come in the next couple of weeks. And so when I say peak, it really depends on the amount of transmission that's occurring out in the community. So if we continue to, gather in crowds, not wear masks, things like that, the numbers will continue to go up. That's just the way the virus works. And so really it's unknown where the peak is going to occur and what that number is going to be.
Dr. Alexander Garza in St. Louis for us with a stark warning of what's ahead for Missouri, the neighboring states, and the rest of this country in the next few weeks. Thank you.